Live now, thanks, Chair, if you'd like to start the meeting.
Thank you. Welcome to today's virtual meeting of the Corporate Affairs and Audit Committee. As the meeting is being live streamed, can I ask all participants that their conduct should reflect this, please? And with that, we'll go to the first item on the agenda, which is apologies for absence.
There are no apologies received, thank you, Chair.
Thanks. So, the second item is, are there any declarations of interest? I don't see any hands, so I'll take that as a no. Third item, the minutes for the 30th of September 2021. And those are to be found on pages 3 to 8. Can we accept them as a true record? Yeah. Thanks, Councillor Rooney. Before I progress any further, could I just ask a question on page 6 and 7 on the minutes? It's about the statement of accounts. And it says there that the aim is to have the statement of accounts for 2020, 2021 to come to the next audit meeting on the 9th of December. Myself and the Vice Chair have had a quick preview of that agenda, and it doesn't appear to be on there. So can we have an update, please? I don't know whether I should be passing that over to Ian.
Yes, that's absolutely fine, Chair.
Thanks.
I think Justin Weston's having some trouble joining, so I can answer that. We've had an increased number of queries off the back of the statement of accounts, and the work's taken slightly longer than we'd envisaged at that time. But we are still aiming to get the reports to this committee in January. That's what we're attempting to do. So it will be further delayed. It's not a case of fault. It's a case of additional work and the circumstances that we're in. So we've been talking to our colleagues at EY, and we're aiming to try and get this to you in January, Chair.
That's great. Thanks for adding. So the next item on the agenda is the HR assurance report. That's with Nicola Finnegan, who's our head of human resources. And joining her, I'm hoping there's going to be Rebecca Thompson, who's a manager of human resources. Is she in attendance?
Hi, Chair. Sorry, I just somehow jumped out of the meeting, so I've just managed to get back in. I'm just trying to see. I'm not sure Rebecca's been able to get in. Don't know why I was having trouble with WebEx. It didn't want to let me in, so I'm sure she'll join us shortly.
Thanks, Nicola. Is it okay if I pass that over to you to present the report?
Yeah, that's absolutely fine.
Thanks.
You want us to share your presentation, Nicola, or do you want?
Yes, please.
Yeah, just bear with me.
Thank you. Right, okay, we can just jump to the next slide, please, Scott. So the purposes today is to go through some of the actions that have been taking place over the last 12 to 18 months, particularly throughout the pandemic period, and to look at a brief overview of some of our sickness, as well as look at some of the next steps that we're going to take moving forward. It has been a bit difficult over the last 18 months, coming up 2 years now, as you can appreciate with the pandemic. So we did put a bid forward to get some assistance in terms of staffing. So we managed to secure some funding through the COVID support money from the government to actually employ a dedicated health and wellbeing business partner to help us support staff through this period. It is a 12-month fixed term contract. The main focus is going to be around providing that support through COVID and the recovery, but also the transition. Obviously, we've got people moving back into the office as well at this moment in time. So it's that transition, and also to look at what we can put in place for the future state. So we are looking forward. We are ambitious in what we're trying to do. We are looking at different ways of delivering this and things that where we can get some sustainable changes so we can maintain them if and when at some point we can't move forward with that post. So next slide, please, Scott. So what have we been doing so far? We developed a working from home best practice guide for a large proportion of the workforce. They literally went home overnight. So we had to put things in place to help them at home throughout that, to make sure that we still maintained their health and wellbeing while they were at home. That's been launched with the new blended working policies as well. So we've had to design a lot of things around this. At first, it was all a bit we played it by ear, but we've had to put some formal policies and procedures in place. We obviously still want to prioritise their health and well-being, but a lot of it is about self-care because they're at home, and it's about managing their own time and managing their own space. So we've concentrated some of the things around that. We developed dedicated mental health and wellbeing intranet pages. Now, these are available because we've got the staff portal. Everything that's on the intranet now is available to the whole workforce. So this isn't just about people who are based in offices. So this mental health awareness information is there, and it sets out all of the resources that are there for line managers and for staff on how they can support each other and how managers can support their employees. We've pushed out a lot of promotional material. We introduced our employee assistance program year before last, and we've maintained that. That's available to staff 24 hours a day, 7 days a week, 365 days a year. And we've had some good feedback on the program when people have used it. We put some electronic posters out there, and we got some little wallet-sized cards that we could leave at certain places. So, for example, down at Cargo Fleet and the depot and places like that, where staff can go in and just take those away with them. They don't have to go to anybody else to access that support. They can just take that card away and use it at any time that's suitable for them. And again, we've had some good feedback, and people have liked the fact that they don't have to go through somebody else to access that support. We have purchased some suicide prevention kits. We've only put a couple of these out at the moment when we've got a supply that we're going to roll out over the next few weeks because we've got more people going back into buildings. But these are the small tins, and basically they contain lots of different information, and they're there to help people in a crisis situation. They were placed in discrete places, if you like, where people can just get them, pick them up, take them off, take some information out, put them back, whatever they want to do with that. And we'll see how that goes, and if needs be, we'll get some more of those. But again, there's lots of information about how they can access lots of services, whether that's immediate critical services or a bit longer term support. So that's being rolled out at the moment. Next slide, please. A large piece of work that we had to deal with that was a bit unexpected, but came because of the pandemic, was the government's requirement for vaccination as a requirement of deployment. So basically, people who were working, particularly in the health and social care environment that was a regulated establishment. So to work in that environment, you had to be double vaccinated, and that actually came into force. The legislation came into force on the 11th of November. So we had to go through an exercise of working out who would be affected within the council's workforce, and working with them to make sure that we had all the necessary plans in place so that people would be doing, would make sure they'd have their vaccinations by the date. The government have actually put out further consultation, and I think it's been agreed now from April next year that's going to expand more into a wider health and social care environment. So we probably have to do a wider piece of work, but where it stands at the moment, there is nobody working in our regulated establishments or carrying out those roles who isn't double vaccinated. So that was a really good piece of work. And go to the next slide, Scott, please. We still maintained our occupational flu vaccine scheme. So alongside people's COVID vaccine boosters and things like that, we still ran the annual flu programme because we have potentially other frontline workers who wouldn't necessarily have, qualified for a booster at this point. So they might be under 40, or they might be on the fringes of where that work is. So we still managed to fund a series of clinics for that to happen. And we've rolled out 250 vaccinations for staff across that, across those services. There was quite a defined definition because the funding came through public health, so it had to be a frontline worker in a specific environment. But we managed to use all of those vaccines, so that was really good. So we've helped provide that extra support. I am aware that even local pharmacies and GP surgeries are doing drop-in clinics for flu jabs and things as well. So any staff who haven't had that, we've sort of signposted them into other places where they be able to access those. As part of the ongoing boost of physical activity, Helen managed to negotiate 7-day free gym passes with everyone active, our local partners, in terms of delivering leisure. And again, that's to try and get people, we're conscious that throughout the pandemic and other things, people, weren't getting out a lot and weren't doing those things, just to try and encourage them to retake up those physical activity. That's something that staff can access. Next slide, please. The Better Health at Work Award. We currently hold and maintain an Excellence Award, which is about us sustaining our progress. So there's lots of things that sit behind the Better Health at Work Award, and you have to meet lots of criteria and demonstrate that you've got things in place to help and support your staff in order to achieve that award. So we've worked our way through up until that and now sustaining our progress and got that Maintaining Excellence Award. It was deferred from last year because obviously it was really difficult to do that when we had people, a large proportion of the workforce, at home, and it was more difficult to do. But we are optimistic that we'll maintain that. And that within that, we've got a wide network of health champions and health advocates. So these are people who are based throughout our services right across the council, and we rely on them to help us disseminate information in order to help us for them to help on a local level. If there's things that they can introduce within their services, or good ideas that people want to share, and we use some of their evidence and their examples within our submissions when we do the Better Health at Work. So we get real live examples of how they've helped people on the ground. So that's a really important part of what we do. And we want to grow that and make it a bit more formal for people and give them a bit more structure so we can help them support people on the ground, which I think is really important. Next slide, please. Our employee network group. So health and wellbeing, it covers everything, and people have a tendency to think it's quite clinical, but it isn't. It's about your whole wellbeing, and part of that, the employee network groups allow staff to get together to discuss issues that are either important to them or they're affected by. So we've got lots of different groups. We've got BAME, LGBT, Gender Disability Carers Network. Now, within those groups, it's not just people, like I say, who are affected. We encourage allies of those groups to come as well, so that if they can help spread the word wider, and get a greater understanding of the impact of things and make things more inclusive, basically. So we've had a bit of a revamp, we've had a relaunch, and all the groups are up and running regularly again now, virtually, obviously, initially, but hopefully back together face to face. And again, we've got Sadia, who is actually now coordinating those groups and helping support those groups to look at how can we break down some of the barriers, what are the things that those groups face on a daily basis that we can do to make working at Middlesbrough Council better for everybody. And if we do that, it's the whole thing, isn't it? If you're happy in your job, you do a better job, and that's the reality. And it gives us a better understanding of the communities that we serve. And we want to reflect that, and we want to make sure that actually we're listening to everybody in all sides of society, so that we can make sure that our workforce is as inclusive as our community should be. Next slide, please. Staff Menopause Support Group. This is a recent thing that's started. And it's when you read some of the figures, it's quite staggering, isn't it? When we say 72% of our workforce are female, and within that 72%, probably 40% of those are either at the point or getting to the point where they'll be affected by this. That's just the people that are physically going to go through it. If you look across the whole workforce and think, well, how many other people in the workforce are partners or parents of or sons and daughters of people who are affected, you begin to realise the impact of that right across the whole workforce. So the purpose of this group, again, is for individuals to come together and provide support to each other, just to talk about that. We want to expand that and get it into, to make sure with other people that are just affected by it. Like I say, family members might want to come and get a better understanding of how, what's impacting on their loved ones, if you like, as part of that. I just thought the bottom point was really interesting, that there's been a 167% increase in employment tribunal claims as menopause being cited as an element with it, whether it's in performance capability or managing health and attendance. I mean, there's some really scary figures, I can't remember at the top of my head, about the number of women who leave employment because they don't feel supported or they don't think there's any other option and they actually leave. You know, we could be losing really good people just because we're not providing that element of support there. So it's something that really, the staff were telling us that they wanted. They were doing that via the Facebook page and other things. So it's been well received, and I think this is one that's probably going to grow and grow. But it's off the ground, which is great. And they're having regular meetings now, so that's really good. Next slide, please, Scott. So other things that are happening or have happened. The mental health awareness it will still be one of our big focuses, and will continue to be. And it could, like I say, it covers such a wide range of things. It's not what we don't want people to pigeonhole mental health is to be a bad thing. You know, we've all got mental health. It's how we manage it and how we, you know, interact with other people and how we recognise it in ourselves and deal with it. We need to take some of that stigma away. But we've done that through promotion of the World Suicide Prevention Day, Mental Health Day, and National Stress Week. So again, we're pushing out information so that people can access it at a time and a place which is right for them. In October, for Breast Cancer Awareness Month, I know there was services did it, and I know it's more difficult to do virtually, but I know we did it ourselves. So we had a service meeting, and you know, everybody wore pink, and we took a picture, and then we shared it. So it was just about supporting those great causes. We did in November. I thought this was really important as well, because the financial impact of people throughout the pandemic can have a, you know, in some circumstances has had an impact on people's overall mental well-being. And the Talk Money Week we did with partners, South Tees Community Bank, HSBC, Barclays, and through webinars and advice and guidance for people who may be struggling or even maybe planning for the future and want some help and guidance to do that. I know as an authority, we were quite lucky in terms of, you know, our staff maintained and weren't, you know, it wasn't like the hospitality sector where you had large groups of people furloughed, but people's partners, people's family members may have been in that situation that's impacted on their household income. So if we can give that support to our staff and they can take that back home to the rest of their family, that's great. That helps our communities. Next slide, please. So I think on this one, we just wanted to show, can you make that a little bit bigger, Scott? I'm not sure that people will be able to. Thank you.
I don't think I can, unfortunately. There is a Zoom option on people's screens. Yeah.
Over the left-hand side where the little magnifying glasses, if people want to use that to make it a little bit bigger. I've got too used to Teams now. I forgot how to do that on WebEx. So what we did with this, we wanted to do just a bit of a slice, if you like, over the last few years and see where we were at with sickness, particularly because of the pandemic. So these figures are taken at the end of Q2 in each of those years. So you can see there was a slight increase in the first couple of years, but then there's been a significant increase in 2021. And if you go to the next slide, Scott, please. And interesting, we've broken this down into the reasons. Now, stress still remains the top reason for sickness. And that's, I mean, this is the last 4 years, well, 3.5 years, isn't it? But stress has been at the top. I mean, it took over from bad back, I think I can remember about at least 7 or 8 years ago, and it was always musculoskeletal issues that were thing, and then stress took over, and it's remained the top reason since then. Now, it's important to note in terms of this, stress includes work stress and home stress, so it can be a combination of those two things. Interestingly, though, it looks like the significant rise in sickness for 2021 has been because of COVID. So we've had more people off with COVID in 2021 at this time than we did in 2020. Now, that's quite interesting, because you would have thought it was more prevalent then and all that, but I think because people are out and about more and they're doing more, people are catching COVID, but they're not getting seriously ill with COVID, which is a really good thing, and you can put that down to vaccination and lots of other things. But it was quite interesting that with our absence figures for COVID have been higher in 2021 than they were last year. But like I say, I put that down to the fact that people are out and about more, and probably more confident that they've had those vaccinations and potentially the boosters now as well. We've got the next slide, please, Scott. So what next? So we still maintain all of the things that we've got at the moment. So we still have occupational health services that are there for support for staff, you know, if we need to, if they're suffering with things, and we can use those for advice and help. We've got, like I say, our employee assistance program, that's available 24 hours a day. We've got face-to-face counselling that's available for staff at the moment as well, should they require that. And when I say face-to-face, the counsellors are being really good. They will do it virtually if somebody's not comfortable doing it, or if somebody really is in need, they will do it face-to-face, obviously within COVID restrictions, but they are providing that service. So all of those things we'll carry on and maintain. We're looking at what else we can do. Like I said, we're talking about reoccupation at the moment, and we know for some people it's quite apprehensive, and I know that there are certain people who've, regardless of the, you know, the loosening of the requirements and things like that, have still maintained quite a strict regime. And those people are a little bit nervous and a little bit daunted by coming back in. So what we've said is we can provide some individual one-to-one reoccupation support for those individuals. That's about having a plan, having a coping mechanism, and we'll work with people who are really struggling, and we'll do that on a phase basis. That's absolutely fine. And I think what we're going to do is try and, rather than look at a big sheep dip approach and try and do something right across the workforce, we're going to do some smaller sessions that we can potentially pick up on smaller groups. So mindfulness, sleep. I think in a previous, some of the surveys that we'd asked, people were finding having difficulty sleeping. So we're going to see if we can run some clinics on that. Musculoskeletal health. Still important. It's not our highest reason for sickness, but it's still important. You know, when people have been working at home for part of the time, they were sat at kitchen tables or were sat at, you know, and it can have a detrimental impact. So as well as us saying, actually, you need to make sure you get up, you move around, and giving them all support on that side, we're still going to look at, is there anything more structured? You know, if somebody's suffering with back pain and things like that, can we do a clinic for that? And some social activities as well, because I think, you know, obviously we have to wait until we can do that safely, but people miss people, and I think it's been really difficult for some people who live on their own. You know, it's bad enough being in lockdown with family members or things like that, and you know, but I know that even within my own service, we've had some people who were on their own for large periods of that time, and they miss that social interaction. So we want to make sure we start looking at things like that as well. And again, to review our internet content, to make sure that it's easy to navigate. It's dead easy if you sit and use a computer every day and you know your way around the internet and things like that. What we want to make sure is that through the staff portal, that every member of staff can access things really, really easily, and it's really set out easy. And it's user friendly. So we're going to do a lot of work around that to make it as easy as possible to be able for people to access that information. Next slide, please. I think that's it, isn't it? Yep, that's it. Any questions? You can take that down, Scott, if you don't mind. Thank you.
Thanks for that, Nicola. Do we have any questions on that report? See Councillor Wright and then Councillor Rooney.
Thanks, Chair. Yeah, my question is, do we engage employees in surveys about their well-being? Do we approach them and ask how they feel about their well-being?
Yes, we do. We're probably due to do, it's been quite a bit of a difficult year because we've been doing lots of different surveys about working from home, about making sure people keep in touch with their managers, about all of the other things. So we've used some of that to put some of this together. So we did a series of dedicated newsletters around health and well-being and some of those things. So we have done, but we're probably due to do another larger staff survey just around health and well-being. And what we've done in the past is looked at some of the HSE stress risk assessment questions and things like that, so we can try and focus in a bit more. But yeah, I mean, it's probably something we'll do early in the new year when we've got people through this reoccupation stage and things will settle down a little bit more.
Thank you. When was the last time it was done then?
Ooh, I'd have to come back to you if that's all right.
Thank you. Thanks, Chair.
Thanks, Councillor Wright. Councillor Roney.
Hi, I'm going to have to apologise. I've got workmen in the house at the moment, so you might be able to hear them behind me. I was just thinking, I mean, all the great measures that you're putting in, Nicola, I mean, it's really encouraging. What's your impression of the overall health of the staff? Do you think we're generally okay, or are you concerned at all?
I think I would say surprisingly good, and I don't want that to sound like negative. And I think it's because we've worked really, really hard. I know there was a survey that went out recently that talked about it was more around engagement, but it asked people whether they felt valued by their manager and things like that. And I think it was overwhelmingly, it was between 70 to 90% in all services, where people were saying yes, they felt valued by the manager. Now, part of that is people being interested in your health and well-being and making sure that you're fit and well. And it's one of those, isn't it? We've gone out lots of times and said to people, you've got this, you've got that, what else can we do? And it's really hard. You give somebody a blank piece of paper and they all just look at you because they don't know what. So what I think we're going to try and do with some of the future survey stuff is say, actually, we are looking at these things. Is this the type of thing that you're interested in? Or tell us something else and get a bit more feedback. And that's where we've come up with the things like sleep, and some of the others, because when we've asked them about how people are feeling about working at home. Those are the things that they're telling us, they do miss that bit of interaction with the colleagues. They're going to get some of that back now because we were reoccupying, which is, I think, why we'll probably wait until in the new year before we go back out and say, right, what's missing now then, what else can we do? But if you look at those sickness figures, if you took the COVID bit out, I know that sounds, you can't just ignore that it's happened, but if you took COVID out, the stress bit and the other bit seem to have actually gone down a bit in terms of percentages. So I'm not overly concerned. I think sickness is an issue and it's an issue in local government. I think there's something going around at the moment. It'll be interesting actually, and I'd probably share it with the committee if we can get some of the information back. Trying to do a bit of a comparison of the 12 local authorities in the northeast. So that will be interesting to see where we sit. It's always one of those that you take with a pinch of salt because everybody measures things slightly differently. So you have to make sure that everybody's including the same things when you're going to compare those types of figures. But it'll be interesting to see how we fare alongside the others. But I'm not overly concerned. I'm not hearing anything from the trade unions. I'm not. So it's not. And we are talking to people quite a lot. So yeah.
Thank you. Thank you. Chair, I'm just going to have to leave the meeting for a minute to sort this out. I'll be back.
Thanks, Councillor Roney. Councillor Higgins.
Thanks, Chair. I was just wondering when you were on about how many people filled the forms in, what percentage of the staff do that? Because it's, it's nice to say 95% think they're getting looked after, but if it's only 20 people out of the service area that you're dealing with, it makes a big difference, doesn't it?
Yeah, it does, absolutely. I think the last one we did within HR when we were talking about how people were getting on at home and things like that, we had over 1,000 people respond to that. So we employ about 3,200 people, something like that. So we were getting about a third of the workforce, which in terms of surveys is quite good, because it's notoriously you don't, if we've learned something, we need to make them short and snappy. We've just sent another one out recently and we only asked 3 questions, and I think somebody just reported back it's only been out there 2 days and we've had 350 people reply already because it's only 3 questions, and we need to do more of those temperature checks, I think. But you're absolutely right, 95% of 20 doesn't tell you a lot of anything, does it? But
no, but it would be good to also look at the service areas, like environment and office worker or whatever. It would be good to see the percentages in service areas as well.
We do that, and we ask people to pick their head of service when they do it. It's a fine line between people not wanting to stick out, isn't it? You know, I mean, we want to make it an element of anonymity so that people don't feel like they can't say what they want to say. But you're right, we need an indication of if there's a problem in a particular area. What we've also done in some areas, and particularly environment, actually, we do give other options as well. So we don't, you know, we've got staff portal, which means everybody can access it electronically if they want to. But particularly in environment, we always look at, actually, do we need to put some paper ones out there? Do we need to have a few other ways, so just so that we can make sure we capture as many people as possible? And we'll continue to do that to make sure. But yeah, when we do the next one, absolutely, we'll break that down into those areas and bring it back to a future meeting if that's something the committee is interested in.
Oh, thanks, Nicola. I think you're doing a great job.
Thank you.
Councillor Cope.
Yeah, thanks, Chair. I just want to say it's very comprehensive. It's quite impressive what you're doing for the staff and things. Because a lot of these things, I mean, I've suffered from insomnia since a child, so I know what it's like to go through that and back problems. So I think it's really good that you're looking at the problems and trying to help people rather than people saying, oh, they're off for a reason. You're looking into the reasons for that. I think it's excellent. Have you thought of extending it to councillors out of interest? Not all do for that, but it might be just a point that it might benefit a few councillors. Thank you.
Yeah. Well, we have, I think, our employee assistance programme and our face-to-face counselling services we have made available for councillors. So I can't see why that wouldn't be appropriate. I mean, lots of the things that we're looking at, we are trying to do it in the most cost-effective way. It's like everything, isn't it? You know, we're a local authority, we have limited funds, but if we can do some things through things like train the trainer and then we can run our own sessions, then we'll do that. But so, I mean, I don't see why we wouldn't be able to open that up to members too.
Thanks for that. Is there any more questions? Thanks for that, Nicola. Is the committee happy to move that report? Thank you. Thanks, Nicola, once again. So we move on to our next item, which is the Legal Services Progress Update, Ofsted Response. In attendance is Anne-Marie Wilson, who's our Head of Legal Services. Over to you, Anne-Marie.
Thank you, Chair. Good afternoon, everyone. I'll share my screen. I don't intend to go through the report line by line, and as I know you've all had it and will have read it, but I'll just pull out some of the key things on there and a couple of updates that I wanted to give in terms of some of the information that was provided. So I'll just wait for that screen to share if everybody can see that. Hopefully that's come through. Okay, so this is I think the fourth time that I've been here to the Audit Committee just to update you in relation to our progress in response to the Ofsted inspection that took place in January last year. So this is a follow-on from the substantive report that we did in March last year, explaining some of the work that we've been doing within legal services in response to that. The first thing I really wanted to go through was just the resources issue. The members will be aware that we have had some issue in relation to resources previously, particularly in relation to recruitment, and that as a service we've gone through a recent service review that was completed throughout the summer and came into effect on the 1st of October. So that, as I say, is now being completed. So within legal services, we're reviewing, we're working within that new service. And that's introduced a number of improvements to the area, including the role of our senior lawyer who now leads the children's team. So because of the way we were set up previously in my role as head of service, because we didn't have any seniors, I look after both children and adults, which particularly over the last 18 months, for obvious reasons, has been a particularly busy area. So that's been a massive help to the team to have that extra support in there from a senior lawyer who can lead them and be available as a first point of contact, both internally within the department and externally. We've also had the welfare lawyer posts have been advertised now for a couple of months in relation to 2 new posts that have been created as part of that legal services review. We haven't had any appointments to those 2 new roles at the moment. As I say, that probably was expected given the difficulties that we've had in recruitment previously. But I have had some discussions informally, and we've conducted one interview, sorry. Unfortunately, that person wasn't suitable, but I think that the advantage that we've got this time that we've had when we've recruited in the past is that we've got a little bit more capacity to be able to make sure that we get the right fit for the team and the right person, rather than rushing in and getting a body, because we're so short staffed. And I think the contribution of the lower case numbers, which I've outlined in the report, have helped us to be able to do that, so that we can take a little bit more time and make sure that we get the right people. I touched within the report on paragraph 8 about some feedback that had been given to myself and Sue Butcher at a meeting earlier in October in relation to some feedback. And I just wanted to update members in that there was a further discussion with Judge Matthews yesterday by our court progression manager. Again, his role I've outlined in the report. That's a new role that we have across the service. And she meets with Paul on a quarterly basis, and the meeting happened to be last night. So I just wanted to update some of the feedback that we were given from Judge Matthews, which again was really, really positive. Had seen a huge difference within legal services in particular and with children's services, but talked about the representation that's happening within the court at the moment, how she'd seen a massive improvement in the presentation, the communication, the conduct of cases, and also some really positive feedback for children's services, such as having more confidence in the care planning that we're doing, that things are being done in a more timely and organised manner, and that when we're raising a problem, we're coming through with a solution. So she said, specifically for Middlesbrough, there are some issues across the board for all of the local authorities in the region in terms of the justice system that we're working on. But she said that her and the other judges were really happy with the progress that's been made from Middlesbrough. So I think that that's a really positive piece of feedback for us to take forward there. The other items within here that I've talked about, obviously, I've talked about the role of the court progression manager and how well that's going, and also the outsourcing of some of our cases. The background to this, just in brief, was that we had a really high number of cases back in November. We were working at about 140 cases. By comparison, we're at about 75 to 80 now. So that was a huge increase. And that led to a project where we were looking to outsource some of our cases and went through a procurement process. We'd anticipated that there would be around 100 cases outsourced as part of that procurement project, but because of the other work that we were doing, that was twin-tracked with some other strategies, including looking at the reduction of care cases, the legal services review. We've had some permanent staff that have replaced agency staff members, and all of those combining factors have meant that actually we've only to date have outsourced 13 cases, and that was since April, with no cases since July 2021, which shows that from a capacity point of view, we now have the capacity internally to be able to absorb those cases without relying on outside support. So that's a really positive step forward for us in legal. I went on within the report just to set out some of the other work that we've been doing within legal and myself personally, such as the care order at home work that's been completed, and also the work that we've been looking at in relation to newborn babies, whereby the North East region was an outlier in terms of care proceedings being issued, and that work's continuing through the local family justice board, as well as the project work that we're doing in relation to the public law working group recommendations. So if I just stop sharing my screen from there, I think those are the things that I was wanting to highlight, and obviously I'm here and happy to take any questions if there's anything from a legal services point of view.
Thanks, Anne-Marie. Do we have any questions on the report? I can see Councillor Roney. Yeah.
Thanks, Chair. Hi, Anne-Marie. Thanks for the report. The information's really encouraging, and you can hear it in your voice. You sound really positive. The court progression manager, what background has that person got? Is it a legal or is it a care background?
It's not. He's a qualified social worker, and I think that was something that we identified when we looked at how we could improve the service, and it's something that Some authorities do, mainly down south, if I'm honest. But when I talk to other leads across the region, I was looking for ideas of, you know, what could we do to try and improve the collaborative working that we have with children's services. And I think sometimes the difficulty from legal point of view is we're looking at it for obvious reasons from a purely legal point of view. And when we have those discussions with team managers and social workers, they're coming at it from a completely different angle. And sometimes wires got crossed, there was things that were getting lost in translation. So the court progression manager's background, he is a qualified social worker, has been a team manager previously in other local authorities. So what we wanted him to do was sort of be that translator, if you like, for want of a better word, of working between, look, this is where legal are and this is where children's services are, and how do we bridge some of those gaps? How do we unblock some of the things that are meaning that the proceedings weren't flowing as well as they could be? So it's been a really positive role for us. He sits within our team, so he is part of legal services and he's part of our team, but very much works collaboratively across both of the service areas.
That's great, thank you. In terms of the staff structure, I mean, I haven't looked, so it might be there. Do we have either a pictogram or a diagram type family tree now that shows what legal services looks like? And is that available without names on the external internet? Because I'm thinking if we're encouraging people to come forward, it might be one of the things that they'd look at to see what the structure of the service is.
I think that's a really good idea. It is some, I do have that, and it's not attached to the report, and that's probably something that should have been attached, but I can certainly circulate that, and I'll liaise with Nicola and see if there's somewhere that we can put that as part of the advert, because you're right, I think that structure is really important, isn't it? And I think when we have done interviews in the past with people who are looking at coming to the local authority, that's one of the questions that they ask: what support is available, what's the team like? And I think particularly in the current climate where people are doing blended working, it's quite difficult. We've got a number of members of staff who started and have never done a day's work in the office yet, and have worked completely, you know, in this strange way that we're all working, you know, and having to adapt to that is quite hard, and build those relationships, you know, internally and within the team and across all of the local authorities. So that's something we're really conscious of, and I think that's a good idea in showing people the support, because some of the positive feedback that we had a couple of agency workers last year, and that's one of the things that they said they were really impressed with by Middlesbrough, was the support that they had in terms of the way that the team set out, the way that we allocate cases, and the way that we work together.
Thank you for that, and that's really good to hear. Thank you.
Thank you.
Thanks. That's a really good suggestion by Councillor Rooney there. Is there any other questions? Can't see any hands, so if I can just ask one. On the paragraph 14, where you stated there was 100 cases that was to be outsourced, and then it was only 13. Did this result in a budget saving?
So it's not a budget saving as such because of the way that the funding was put together. So the funding for those 100 cases came from, some of the funding came from an Ofsted contribution from the Ofsted funding, and some of it came from legal services budget where it was a legal services pressure. So although having that project and the costs associated with that project meant that there was still a pressure on legal services, it was a reduction in that pressure. So because of the spend that we're anticipated on the care cases that we have outsourced at the moment, that is going to leave us with about 185,000, I think, of the projected spend. We'll have 185,000. So we anticipate that will return to the Ofsted funding pot, and then from a legal services budget point of view, it'll be a reduction on the pressure that we have within legal services rather than an actual saving, if that makes sense.
Thanks. And are we now satisfied that legal services are providing the quality of service that is required by Ofsted?
I think I am. From my point of view, I think, you know, I've been here for quite a long time and had I'm not sure if it's unfortunate or fortunate position of taking over this role on an interim basis in February 2020. So on the back of the Ofsted report and just pre-COVID. So working on the basis that, you know, over that 18 months we've had the Ofsted improvement journey, we've had a legal services review, we've had the impact of working in COVID and the way that that's impacted on working. I can say from experience, there's nothing like doing a High Court hearing from your kitchen table. Just, you know, we've had a really unusual journey over the last 18 months, but I've seen a huge improvement in the way that we're working, in particular from the collaborative way that we work with children's services, which I've touched on already, but legal service are involved in proceedings all the way through. We're involved in all of the discussions. There's very much a joint working rather than this is legal services job, this is children's services job. We approach all of those issues and come up with the solutions very much collaboratively along the way, and I think that that's improved the working. We're much better at monitoring and tracking proceedings. We're much better at being proactive when there's an issue rather than reactive, and I think that the reduction in cases and changes in the teams have contributed to that. But I think that's not just my point of view. I think that's reflected in some of the feedback that we've had. I've touched today on the feedback that we've had from Judge Matthews, but we've also had really positive feedback from CAFCAS and from other partnership agencies that we work with, such as with the police and with like private practice. So I think that from our point of view, there really has been an improvement. And I think, you know, we know that we've still got some weaknesses. We're working hard on those. We've got some priorities that we're working on. The two main ones at the moment being court deadlines and trying to improve the quality of evidence, in particular around the analysis. But certainly the feedback that we're getting is that we are where, you know, we've made big steps within that journey, and we'll continue to do that, working on the priorities that we've identified.
Thanks. Seems to be moving in the right direction, and thanks very much for everything that you're doing.
Thank you.
So can we note that report? Thank you. Thanks, Anne-Marie. So we'll move on to the next item, which is the Historic Children's Services Spend. This is going to be presented by Ian Wright, our Head of Finances. And to assist him in case it goes outside his remit, there's going to be Mr. Paul Rudd, he's Residential Care Service Manager. Thanks, Ian.
Thank you, Chair. The finance element will be presented by Andrew Humble, if that's okay, and welcome Paul to the meeting. Thank you very much.
Thanks, Ian.
Right. Thanks. I'll start off. You've had the report, so I'll go through the main bits of it and then we'll answer any questions. As we said, me and Ian are here from finance and Paul's here from children's care to answer any operational questions. So firstly, this was a request of the Corporate Affairs and Audit Committee, and what it does, it provides information of the last 5 years of the children's care, just the children's care part of children's services, and it gives information on the expenditure and the number of children looked after as well. If you look at the table, I'll just share my screen. Sorry, I forgot about that. I'll just share that. Sorry, it's just there. Sorry. Right, sorry about that. So the table in paragraph 3, as you can see, the expenditure has gone up quite considerably since 2016-17, and also the number of children looked after has gone up and then coming down. But the one thing to note is we had a peak in September 20 where we had about 702 looked after children, and we're on a downward trajectory now in 21, the remainder of 21-22. Got to remember as well, September 2020, we had the effect of COVID as well. There was quite a lot of COVID coming in from that. So I think those are slightly distorted, and we would have been on a downward trend, I think, in that year. So what you can see there in the table in paragraph 3 is we are on a downward trend. Just go over there. We've then just done a bit more detail on the external residential placements. External residential placements make up a vast amount of the expenditure. As you can see in paragraph 7, those have also gone up, And again, they're on a downward trend. And as you can see, at the end of March 2020, there were 74 external residential placements. Currently, there's 47, and that is a massive reduction compared to what we have. So I'll just go on to something on paragraph 9, which is quite important. This is from the Department of Education Commissioner's report in July 2021. The Commissioner reported on the progress made and identified that within the permanency strategy, considerable progress has been made in tracking and oversight of children within the care system. This has led to impressive performance in timely moves for more children at adoptive placements, significant increase in the use of special guardianship. We also see evidence of a more appropriate use of public law outturn, as Anne-Marie was saying about the legal stuff, reduction in the emergency hearing, and a stronger relationship of trust, as described with CAFCAS. So what they're saying is we're getting people into more permanent places. Obviously, we'd like the ultimate is adoption. You get special guardianship, you get fostering in between that. So to get people out of external residentials is the key. And just paragraph 10, just make a note there that, as I said, we had a peak in September 20 of 702. We're 533 currently. We've got plans to get down to 416 by the end of 23-24. And I'll come on a bit more onto that. And we've decreased the rate per 10,000 children aged under 18. The measure children looked after when comparing across the country by rate per 10,000 children. So we were the second highest of all unitaries with over 200 in September 20. We've gone down to 162. That brings us closer to our statistical and geographical neighbours. Just go on a few more elements on the financial sections. As you know, we've regularly reported in budget monitoring reports, MTFP updates, that obviously pressures in children's, you're all aware of them. We've had the increase in the cost of providing care. So we're closely monitoring, as you can imagine, so much for we do it weekly, more or less daily. We know where things are changing. So we've also got a real positive in that between Children's Care Finance and a lot of other people, we've managed to get a 3-year plan, which tries to put targets in and tries to make sure that we can get the costs down. As part of that, as shown in paragraph 19, the recent MTFP report, which went yesterday to council, there was 3.3 million to be provided to children from 24-25. That is what's going to be seen as creating a steady state for the service to get us down to an average level. And that'll mean that all the improvements we've made are not compromised and also on firm financial footing. And what that will mean is, and this is a really important point, we'll have had over 9 million pressure on our budgets from the start of 21-22 to just over 3 million in 24-25. That's 6 million reduction. And that is quite a big reduction. And that's a pertinent point to make. It looks as though we're putting 3 million in. Obviously, we are in 24-25, but that's a reduction from the 9 million we have been over the last year or so. And I'd just like to make the point in paragraph 22 that there's been a lot of work both on the financial, on the budget monitoring and on the performance side. The performance data we get now is extremely good. We can track things that links into the financial data. That hasn't always been the case within children's services and children's care, but as Anne-Marie said earlier, by all services working together, that's real improvements in that. And there's real-time data now. And the 3-year plan that we've got with children's services on the MTFP is something not a lot of councils have or have tried to do. So that's a real positive, I would say. Obviously, the one thing I'll add is that it's obviously we will get peaks, we will get ups and downs on this journey over the next 2 to 3 years. There will be things that happen. We may get some peaks, we may get a couple of children in here and there, but the key is to moving them downwards from high cost external residential placements down to more permanency and low cost placements. So that's where I'll leave it there, and invite any questions both of a financial nature and to Paul from an operational. I'll just stop sharing now then. Thanks.
Thanks, Andrew. Is there any questions? Councillor Roney?
Thanks, Chair. Yeah, thanks, Andrew. The charts that you've shown us, paragraph 3 and paragraph 7, and we've got the projected figures as the last entry on both of those.
Yeah.
Is that projected presumably till the end of the financial year? And when was the projection dated from? So when was the snapshot dated from that gave you the figures, the estimated figures for the end of the year? I just want to understand that a little bit better.
No, that's fine. The RS at the end of the year, and obviously what you've got to remember is the done as currently probably the last couple of weeks or whatever, you know, they're up to date current figures. The current projections, obviously within them there will be half year effects of some of the savings, so you won't have the full year in 21-22. So when you get into 22-23, if everything else remains equal, you get the benefit of those full year benefits of those children looked after numbers coming down and the external residential numbers coming down, which is really important to understand. They are as will be financially, as we think we will be now financially at the end of this year. So at the end of March, So obviously, as we move into another year, if all else remains the same, we will get the full year effect of those savings and those reductions, for example, from the 74 external residential to the 47. So that's really important to note.
Right.
Yeah,
I think so. Can I ask then that the charts or the figures are brought back at the end of the third quarter so we can measure that again, just to see if there's any variations? Or wide variations.
That's I think we'll link them into the quarter 3 budget monitoring as well. And if we tie them so we've got a consistent set of figures tying back to here for that, that would be good, I think.
Okay, thanks. And I just want to say thank you to the team for working so hard. It's been an incredible journey, I think, for all of us. Well, thank you.
It's, Councillor Cope.
Thanks, Chair. I just want to congratulate everybody concerned with getting the figures down, because as you've shown, it went up a huge amount and now it's coming down again. I know it'll probably take a bit longer to come down, but getting away from using external children's care and getting into our own care, getting it into something we can control, which I think is much better for mainly for outcome of the children, as well as financially as well, and the long-term ideas of more fostering and things like that. It is a far better outcome for the children and of course financially for the council. So just congratulations all around. It is going the right direction. It's going to take a bit longer, but it is. So congratulations to everybody. Thanks, Jim.
Thanks for that. Councillor Higgins.
Thanks, Chair. All those savings, this 6 million savings, hopefully, will they be used for that service area to get more social workers in and to help the service area?
The 6 million.
Yeah, sorry, go on.
The overspend at the moment, there's a 9 million-ish overspend, or there was at the start of the year. So that means that has been covered by other services across the council to get a balanced budget. So reducing them means less reliance on savings in other areas. The 3 million that is going in to children's services in 2024-25 will produce, part of that is for staff in to try and improve the staffing, so we don't have as many agency staff, because that is a key factor as well.
Yeah.
Getting our own staff and not having agency and reducing them. You'll never get rid of all agency staff. Every authority has an element of agency, but it's getting it down to more of an average level. And part of that funding will help that. So what this will do is help us to stop overspending in this area, basically, and therefore stop creating a draw on other services within the council to balance that overspend. That makes sense.
Yeah. I'm concerned. I know you're doing a good job, but I can only think of children. I can't think of finances, because as a law we have to protect, and they are the main thing that we have to do is look after the children and the elderly. They're the only two legalities that we have to see to. So yeah, I know they're doing a great job, and the finance people, you know, Ian and yourself, they're doing a great job. But can I just say that when I'm thinking of children in care, I'm thinking of children in care, and you know,
Yeah,
we'll get the monies from somewhere.
one of the things to note is the Ofsted improvement and improvements in practice lead to lower financial costs. So the practice improving is why we're getting lower financial costs as well. So they are interlinked. So the care of the child actually improves, decreasing the cost, which is a key point to know. Bad practice will lead to increased costs, which one, you don't get good outcomes for the child, and one, you get increased financial cost. So that is really important to note. And it's not what everyone thinks, because everyone thinks reducing the expenditure will lead to worse care for children.
I don't think Sue Butcher would allow that.
No, and I think it's testament to the work, just from a finance point of view, me sitting on the outside as finance, it's testament to work that's gone in children's care and children's services wider, that we're seeing these decrease in expenditure. And those things like the permanency that the DFE commissioners pointed out is really, really positive news, and shows that we're on the right trajectory in looking after children as well.
Yeah.
So.
And it's nice to see the council service areas all working together for the same thing. So thank you very much.
Yeah.
Can I also answer that question? It's also important to recognise that when we bring children back to Middlesbrough, to their hometown, that they have appropriate services in Middlesbrough. And over the last 2 years, we've developed a number of services. The Futures for Families Hub, where we've returned children from really expensive external placements back home and then rehabilitated them home to family, which also has a financial saving to the local authority. And our own services are really robust, quality assured by Ofsted, and have really good Ofsted ratings. And we secure permanency within those provisions, but the children have stability in their own area, so they can continue with therapeutic intervention, continue to attend the same schools. Otherwise, when we place them out of area, they don't have those links, which creates permanency, stability and continuity for the children of Middlesbrough, and also helps us to develop further services in the future to support the children to return back home. We have last year developed a 16+ service for young people who are in external residential, to give them the opportunity to come back to Middlesbrough and prepare for independence when they leave house care at 18 years old. And you know, that service had 9 beds available. We fluctuated between 8 and 7, and we currently have 7 young people living there who are preparing to move on to adulthood. So it's all really positive steps in terms of developing our own service and our own residential offer to our young people.
Thanks for that input, Paul. Ian, did you have your hand raised?
I did, just briefly, Chair, if you don't mind.
Yeah.
Just to reassure Councillor Higgins and the committee, the figure that's in the medium-term financial plan for the long-term budget, which is an increase of 3.3 million from the current base budget, the calculations behind that figure are led by Children's Services. So Sue Butcher and Rachel Farnham and Rob Brown and their teams, that's how much they think they need to run a quality Children's Services department. Now, we've worked with them on that, and there is an element of challenge and debate, but they have led in that. So it's a figure that they are comfortable with based on what we know at the moment. Thank you, Chair.
Thanks, Ian. Thank you, Chair.
Thank you. Is there any more questions? I would just like to echo the committee there. It's a really positive report. We've had a couple today, but especially on Children's Services. We know how hard it's been over the past few years and how people are starting to turn it around. The excellent work by Ian and his officers. And I know Ian was really keen to grasp this nettle because we were really overspending in this area. But we are bringing the costs down, and also we've got the watchful eye of Ofsted still on us, so we're not trying to cut costs anywhere, but it just shows the collaboration that's taking place between departments, and I think the committee would like to thank everyone who's doing this vital work, so thank you for that. So with that, I'll go to item 7. It just says any other urgent items which in the opinion of the chair which may be considered. I don't have any. Does any of the members of the committee have anything to bring up? No? So with that, just before I close the meeting, I would just like to thank the officers who've organised today's meeting. It was an additional meeting, wasn't on the schedule, so I really like to thank them for that. And also the committee and everyone who's taken part today. They've taken the time out of their busy schedule, so thanks very much for that. It's greatly appreciated. And I'll see you all on the 9th of December. Thank you.
Thank you.
Thanks, bye.
Thank you, Chair.
Thanks, Chair.
Thanks, Chair.